Hi, I'm Savannah, and I provide solutions to reduce employee burnout in healthcare organizations. A lot of healthcare leaders are trying to address the burnout crisis, but there's limited information about what to do at the organizational level. Burnout Reduction 101 was developed to provide healthcare leaders with strategies, tools, and resources to create a healthier workplace and reduce employee burnout. In this 5-part webinar series, you will learn how to assess burnout in healthcare organizations and plan for improvement. The series starts from the very basics of what burnout really is and why it's so prevalent in healthcare, and goes all the way through how to implement the solutions that are provided. It was designed for leaders of healthcare organizations, but it can be beneficial to anybody in healthcare, including instructors, students, policymakers, mental health professionals, and entrepreneurs. And you can grab the full series right now for only $27. I look forward to hearing your takeaways. First, I've had a lot of people asking, how did you come up with solutions to burnout in healthcare organizations? So I want to go ahead and address that first before I get into the content. So most importantly, I've done extensive research on this topic. In addition to my research, my education and experiences have helped prepare me. And in addition to my bachelor's and master's degrees in nursing, I also have a lot of additional training in business and in leadership. I've read a lot of books and a lot of articles pertaining to workplace culture, leadership, burnout, and everything that ties into this topic. I've taken a lot of continuing education classes related to this topic. I'm a member of the American Nurses Association and the North Carolina Nurses Association, where I get a lot of additional information and resources. I actually worked in an organization that attempted to go through a cultural transformation and create a healthier workplace environment. And I got really involved in that as much as I could. I had a course in my master's program at that time. We were given an assignment of an organization that was going through a crisis, and we had to help them get things back in order. So during that time, the organization I was working with was going through a crisis. They brought in a bunch of consultants. So it really helped me to understand more and really develop an interest in this topic. I saw things that they did well in that organization. I saw things that could have been done differently. And it was just a good experience. I actually joined the strategic business planning team at that job during the same time frame. So I was able to see what was going on as far as planning for improvement and how the organization was using the suggestions from the consultants. In addition to that, I've had a lot of valuable conversations with people who experience burnout, and I have personally experienced burnout. I was not experiencing burnout at the time that this series was developed. However, earlier in my nursing career, I did. So a little about my experience with burnout. I relocated to a new city, started a new job. I was really excited. And I started working, and people were complaining a lot. And at the time, I didn't understand. So time went on a little bit, and after my orientation ended, my caseload piled up so high, and it got overwhelming so fast. But I kept going. I just stayed late at work some days. I tried to make the best of the situation and just learn as much as I could while I was there. On top of that, I was micromanaged. It's really stressful when you're an independent person, and most healthcare professionals are critical thinkers. They're independent thinkers, and a lot of people join the field to be able to use those skills to take care of other people. So on top of that, I had one child at the time. She was starting kindergarten, and my work schedule was 8 to 5, but her school schedule started at 8 o'clock too. And they couldn't be dropped off at school before 7:30 a.m., but I had a 30-minute commute to work. And the traffic here can get real backed up in the morning, especially if there are accidents, if there's rain or anything. So my day started out stressful every morning trying to get there by 8 a.m. And I actually tried to have an honest conversation with the supervisor to ask if I could get a flexible schedule and maybe work from 8:15 to 5:15. Being that I was staying late a lot of days anyway, I was already making up for the time, so it wouldn't have been a big deal for me. But I asked if I could work 8:15 to 5:15. That way I can get my full hours and not have to be so stressed out in the morning on those days that traffic was backed up and I wasn't able to make it there by 8 a.m. But my honesty actually ended up backfiring on me, because even though the organization allowed flexible schedules, they left it up to the department to determine if they would allow their team to have a flexible schedule. And the particular team that I worked on said, no, our schedule is 8 to 5. Everybody works 8 to 5. And there are no ifs, ands, or buts about it, basically. And we had micromanagement. And then on top of that, when I started the job, I expected to be in the community more. It was a home visiting job, and we did a lot of visiting to doctors' offices and hospitals. And I was sitting in a cubicle more than I expected. It was really uncomfortable. I had a lot of back pain because I was sitting in an uncomfortable chair all day. And just all that over time led to burnout. It was really stressful. I stayed in that position for a few years, hoping that things would change, but it pretty much stayed the same. So I eventually ended up leaving there. Thankfully, I haven't experienced burnout since then. So a couple years ago, I just started hearing about burnout everywhere. The World Health Organization had come up with a new definition for burnout and gave details of what it looks like so it could be easier to identify. That was in the news everywhere. It was in healthcare news and business news. There was a lot of articles about it. I saw articles everywhere. They were literally coming to my inbox. Burnout was just following me. Everywhere I went, I saw burnout. And on top of that, old coworkers, current coworkers, friends who worked in different cities, people were just talking to me about experiencing burnout. So during that time when I kept hearing about burnout, I had a lot of ideas about how the issues could be resolved at an organizational level. Most of the literature and research out there, the recommendations are targeted towards individual healthcare professionals, but you don't often see information about how to deal with this at an organizational level. So I had ideas based on stuff that I saw in my experience in the workplace, and differences I saw with different leaders in the same positions, and things that I saw when my organization went through a cultural transformation. And that gave me the idea to write an article. So I started researching evidence to back up the ideas that I had, and I took a continuing education class to learn how to write for publication. So I learned a lot during that time. Also around the same time that I decided that I wanted to write that article, I went to a networking event. And at this networking event, there was a panel of nurse leaders. The leaders on the panel each gave us an explanation of how they reached their positions. So one of the leaders was an executive level leader in nursing, and gave us the whole spiel about how she made it into that executive level position. But at the end of that spiel, she said something to the effect of, so I never want to hear anybody talk about being burnt out, because all you have to do is just move on to another position until you find your sweet spot. So that statement really blew my mind, because I thought that there's no way someone could be that far removed that they think it's that easy. Yes, there are a lot of different areas you can go into in healthcare, especially in nursing. You can do like so many different things, but it's not always easy to get into those roles. Sometimes you have to know somebody. Sometimes they want you to have 10, 20 years of experience, or you're competing against people who have 10 or 20 years of experience. So people often are not able to get into those roles that they really desire to get into. So you have to really tough it out while you're trying to get that experience and trying to work your way into those positions that you desire. And that confirmed that someone needs to teach leaders in healthcare organizations what their staff are going through and how they can address the issue.